You want me to go?
Yeah.
Yeah, it's
Okay.
recording.
Okay. My name's Adelia Mesa, and we are doing our presentation on clubfoot. So the pathophysiology, clubfoot is one of the most common deformities of the skeletal system. It is characterized by a foot that has been twisted inward or outward. This happens 1 in 1,000 live births. In clubfoot, the tissues connecting the muscles in the bone tendons are shorter than usual. About half of children with clubfoot have it in both feet. Doctors are able to treat clubfoot without surgery. Diagnosis. A doctor recognizes clubfoot soon after birth from looking at the shape and positioning of the newborn's foot. In some instances, clubfoot is seen before birth during a routine ultrasound exam in week 20 of pregnancy. Physicians can do nothing before the birth to solve the problems, but it may give the parents more time to learn about the condition and to schedule an appointment with an orthopedic surgeon and a genetics counselor.
Risk factors: family history of clubfoot, such as parent or sibling with the condition, smoking during pregnancy, too little amniotic fluid surrounding the baby during pregnancy, and other skeletal birth defects. For symptoms, the top of the foot is usually twisted downward and inward, increasing the arch and turning the heel inward. The foot may be turned so severely that it actually looks as if it is upside down. The affected leg or foot may be slightly shorter. The calf muscles in the affected leg are usually underdeveloped, and despite its look, clubfoot itself does not cause any discomfort or pain.
So treatment for clubfoot should start as early as possible because the skeletal system is still developing, so it's easier to manage. And because the skeletal system is still developing, if it's not being treated, the bones will continue to grow abnormally. So treatment consists of splinting or casting. The purpose of that is to hold the foot in the right position or alignment. Passive stretching exercises is recommended for mild cases of clubfoot. And if these methods do not work, surgery is usually done after 3 months. And 5 to 10% of infants born with club feet will require surgery. It's usually because they have very severe deformities with stiff ligaments. And successfully casting the treated foot will nearly resemble a normal foot. It's just that the treated foot will show smaller leg muscles and a little bit shorter than of the treated foot. So the cast is made of plaster or synthetic materials such as fiberglass or polyurethane. The plaster cast is the most used. It consists of crinoline that has powder plaster in its meshwork. Plaster of Paris, it's also just calcium sulfate, is put in warm water before being applied over cotton wadding or stockinette. It usually dries from the inside out and takes 24 to 40 hours to dry, and toes are left exposed for observation of capillary refill, circulation, and swelling. So the Ponzetti method, it's a clubfoot treatment in over 4 to 6 weeks. The bottom picture, it shows 5 stages. It usually requires 4 to 6 casts followed by a Achilles tenotomy. And what it is that it cuts the tendon to release tension and allow for the foot to dorsiflex. After that surgery or cut, one final cast is applied and left on for 2 to 4 weeks. And even after that, a brace will still be worn. It's worn for 24 hours a day for 3 months, and it's only worn during naps and nighttime until the child is 3 years of age, or depending on the severity of the clubfoot. So I just wanted to show a picture of how the Achilles tenotomy is done. As you can see, the clubfoot has a defect and they just make a small cut behind the ankle, and then they reposition the feet. And with that cut, it allows the infant to turn the ankles upwards or dorsiflex.
So prevention. There's not really a reason why it is caused, so you can't really prevent it. However, you could reduce the risks of clubfoot by not smoking or spending time in a smoky area. Of course, not drinking alcohol or using drugs that aren't recommended by your doctor. For this, you want to start early treatment. So, most children with clubfoot can walk, run, and play without any of their pain, without any pain. Complications of clubfoot. Well, this is a birth defect that does not cause complications until the baby is able to walk or stand. Some of these complications can include their leg length, which usually is when the affected leg is slightly shorter, but generally does not cause significant problems with mobility. Another complication is the inability to walk normal. The child with the clubfoot may walk on the ball of the foot instead of or outside of the foot instead of the sole. And then lastly, they could have arthritis also as a child.
The nursing care for clubfoot should be treated as soon as possible to minimize the probability of the muscles and bones continuing to develop abnormally. The amount of pressure that you need to correct the clubfoot is up to the point that the joint has reached full exertion. Being extremely gentle when manipulating the baby's foot to ensure the tiny cartilage and bones are being handled correctly. And then a new cast applied weekly for 5 to 8 weeks because of the growth of the infant. And then when the baby has a cast, you're going to want to check for signs of decreasing pore circulation, assess for the cap refill time of the baby's lower extremities, check for any cyanosis, numbness, coldness, swelling, or pallor. And then the patient teaching for the caretakers of a child with clubfoot are passive stretching exercises with the mom to help maintain the corrected position after casting. Educating a caretaker about checking the baby's toes in the cast several times a day to ensure they are pink and warm when bathing or diapering baby. Be sure to keep the cast dry. If the baby has a cast that is still wet, do not press fingers into the cast as this can press on underlying skin and cause damage. Reinforcing the importance of ongoing care and the process after the cast is removed. And then to educate the mother or caretaker about therapy and their responsibility of follow-up care. And then also, if a mother or caretaker is struggling financially, you can make a referral to social services so they can get some help with that. Here's our reference page, so feel free to ask any questions you may have. If anybody else wants to add anything, guys, feel free to do that. If not, I'm going to end the meeting.